Namaskar. I am Dr. Aarti Chaudhary, Assistant Professor in the Department of Ancient Indian History, Culture and Archaeology at Vasant Kanya Mahavidyalaya, Banaras Hindu University. I welcome you once again in this 12-week course titled History of Science and Technology in Ancient India from Harappan Civilization to 7th Century CE. Today, we are going to discuss new module which is module 8 and lecture 1. The title of module 8 is Healthcare and Surgery in Ancient India, and the title of lecture 1 is Charak, the contribution of Charak in the field of Ayurveda. So, let us start this Ayurvedic journey with me. At first, we have to discuss the learning objective of this particular lecture. So, the first learning objective of this lecture is to understand principles of Ayurveda mentioned in Charak Samhita, to study the diagnosis and treatment of disease described in this text, and the final learning objective is to discuss the holistic approach of healthcare according to Charak. In this particular lecture, we are going to discuss about introduction of Charak, description of Ashtasthan, disease and treatment, gynecological treatment, pediatrics treatment and medicinal herbs which is mentioned in Charak Samhita. Before starting the contribution of Charak, it is necessary to understand this Brihatrayi means the great trio, refers to the three foundational classical texts that form the core of Ayurvedic knowledge and practices, the Charak Samhita, Sushrut Samhita and Ashtanga Hriday. These texts are considered authoritative and comprehensive, covering all 8 branches of Ayurveda including internal medicine, surgery, pediatrics, psychiatry and more. The Charak Samhita attributed to Charak focuses on internal medicine and is known for its systematic approach to diagnosis and treatment. The Sushrut Samhita, authored by Sushrut, is a seminal work on surgery and anatomy, offering detailed descriptions of surgical procedures and instruments. The Ashtanga Hriday, written by Vagbhat, is a more concise and accessible compilation that integrates knowledge from both Charak and Sushrut, making it widely used in Ayurvedic education. Together, these texts provide not only medical knowledge but also philosophical, ethical and spiritual insight, establishing the foundation for holistic health in the Indian knowledge system. Now, the introduction of Charak. Charak was an ancient Indian physician and one of the most significant contributor to the field of Ayurveda. He is the best known as the author of compiler of the Charak Samhita, a foundational text of internal medicine called Kaya Chikitsa in Ayurveda. His work systematically organized earlier oral and written traditions into a cohesive and practical medical treatise. Now, the discussion of Charak, date of Charak. There is always a big debate regarding the date of the Charak. So, if you want to just frame the date of the Charak, we have to rely on the different discussion given by the different scholars time to time. So, can we assume the approximately right date of Charak. According to Dr. P.V. Sharma, Charak likely lived around 100 CE, aligning with the Kushan period. Julius Joly placed Charak between the 1st and 2nd century CE, suggesting that his version of Charak Samhita predates its later redaction by Dridbal. R. Harnale date Charak to the 1st century BCE, proposing that his work came before the significant penetration of Greek medical ideas into Indian science. The Charak Samhita itself mentions the earlier sage Agnivesh, indicating the Charak was a compiler and editor who systematized existing medical knowledge. The Charak Samhita is divided into 8 sections known as the Ast Sthan. Each sthan focuses on a different aspect of Ayurvedic knowledge and practice. First one is Sutra Sthan, second one is Nidan Sthan, Viman Sthan, Sharir Sthan, Indriya Sthan, Chikitsa Sthan, Kalp Sthan and Siddhi Sthan. These all sthan are very important in terms to understand a proper systematic study of Charak Samhita. The Sutra Sthan is the foundational section of the Charak Samhita containing 30 chapters that lay down the essential principle of Ayurveda. It deals with the fundamental theories such as the three dosha. What is three dosh? This is Vata, Pitta, Kapha, the concept of health and disease, the quality of a good physician, patient and medicine, and the importance of lifestyle and diet in maintaining health. This section also covers guidelines for daily dincharya and seasonal routine ritucharya, preventive healthcare, ethics in medical practice and the role of spiritual practice and moral conduct. It serves as the philosophical and practical base for all other sections. So, I told that these all sthan are basically based on the health care of human being. Not only the physical health as well as the mind and the soul. So, the dincharya and ritucharya is very important to just good for in health. The daily routine should be in disciplined and according to the season the lifestyle should be changed, and this is the key concept for the healthy life which is present in Sutra Sthan. The Nidan Sthan is focused on diagnostic and contains 8 chapters. It provides detailed explanation on the cause, Nidan, premonitory sign, Purvarupa, actual symptom, Lakshan, pathological development, Samprapti and complications, Upadrav of various disease. This section plays a vital role in understand how imbalance in the dosh lead the onset of illness. It includes major disease such as fever, jwar, skin disorders, kusht and diabetes, prameha and many others. This systematic approach helps physician accurately diagnose disease based on observable sign and symptoms. Now moving towards to the other sthan, what the other sthan gave us regarding the information of healthcare. The Viman Sthan explains the qualitative and quantitative assessment of food, drugs and body elements and elaborates on factors affecting health and disease. It also discusses the characteristics of ideal patient and physician, methods of clinical examination and the importance of understanding disease causation. This section includes discussion on dietetics, epidemiology and the ethical responsibility of a physician, emphasizing logic and reasoning in medical judgment. So, just see, it is really very interesting that the ancient rishis, the ancient Vaidya or you should call doctor, whatever you want to call, they not only focused on the medicine, treatment, the treatment of body, soul and mind, as well as they mention the duty of a particular physician regarding their patient, the duty of a hospital, the duty of their morality, everything is mentioned in Charak Samhita. The Shariristhan delves into human anatomy, embryology, philosophical concept of life and consciousness. It describes the process of conception, fetal development and the formation of body tissues and the influence of parental factor on the child. It also explores the relationship between the physical body, mind, manas and the soul, atma. The section discusses the formation of the sense, psychological factors and the importance of moral behavior. In a physician, it integrates medical science with metaphysical thought, showing Ayurveda holistic understanding of life. Next is Indriyasthan, contains 12 chapters and focus on prognosis by interpreting the sign observed through the sensory organs. Indriya. It deals with subtle and often mystical indicators of impending death or incurable conditions. This section aids physicians in determining whether a patient disease is curable or terminal by the analysis, dreams, changes in voice, skin color, behavior and other signs. It emphasizes the importance of prognosis in treatment planning and teaches physician to respect the natural remedy of healing. Next is Chikitsa Sthan, is one of the most important section, be careful, comprising 30 chapters dedicated to treatment, which is called in Ayurveda Chikitsa. It presents a comprehensive account of therapeutic approaches to various diseases like fever, tuberculosis, skin disease and more. This section also introduces specialized therapies like Rasayan, rejuvenation and Vajikaran, aphrodisiac therapy to promote longevity, vitality and reproductive health. It outlines the use of medicine, dietary plans, lifestyle modification and detox procedure to restore health. The Chikitsa Sthan is practical core of Ayurvedic clinical application. Next is Kalpasthan. It is with 12 chapters, concentrate on pharmaceutical formulations, particularly focusing on Vaman, emetics and Virechan purgatives. It provides detailed method for the preparation, dose and administration of various herbal and mineral based medications. This section also explains how to manage drug reactions and complications during cleansing therapies. It emphasizes the importance of purification in the treatment of deep rooted disease and set the stage for the therapeutic applications covered in the Siddhisthan. The Siddhisthan also with 12 chapters discuss the successful execution of Panchakarma therapies. This is Vaman, emesis, Virechan, purgation, Basti, enemas, Nasya, nasal therapy and Rakta Mokshan, blood letting. It guides physician to how to access readiness for detox procedures, manage complications and ensure effective result. This section illustrates clinical case management and demonstrate how mastery over therapeutic procedures lead to successful outcome in Ayurvedic treatment. It also encapsulates the culmination of all medical knowledge discussed in the previous section. It is the basic core of the Charak Samhita and it gives a plethora of information regarding the holistic development, holistic treatment of a human body, mind and soul. Let us see what is the other information mentioned in Charak Samhita in our next upcoming slides. Information regarding disease and treatment. Here I mentioned few of them which is very important and they are still ongoing in our present society. So, I took this. So, you can correlate it with yourself very easily. First one is Jwar, fever. Considered one of the most important disease, Jwar is described as an imbalance of all three dosh, Vata, Pitta and Kapha. What treatment? Herbal decoction like Guduchi and Tulsi, fasting, sedation therapy, Swaidan and purification therapy such as emesis, Vaman and purgation, Virechan depending on the dose involvement. So, first the Vaidya detect what is imbalance in a particular body, whether it is Vata or Kapha or Pitta, and on the basis of that deficiency they start the treatment of a particular body. Next is Atisara, diarrhea, frequent passage of loose or watery stools caused by aggravated Vata, Pitta or Kapha. Treatment is use of astringent herbs like Kutaj and Bilva, light diet, rice gruel and rest, just rest for the patient. Next is Grahani, digestive disorders, a condition of the digestive system caused due to weakened digestive fire, Agni. Treatment, use of digestive herbs such as Pipali, ginger, Triphala and proper diet and lifestyle regulation, that therapies to restore Agni. Here I would like to mention this Agni is very important. We already learned about the Vedic sciences where Agni took place very important place in the Vedic literature. This Agni is also deeply associated with the Ayurvedic text as well. This is just related to the human body as well as it is related to the spiritual universal relationship with the body and the mind. Next thing is Pandu, anemia, resembles modern day anemia caused primarily by aggravated Pitta, and the treatment process is iron rich herbal preparation like Mandura Bhasma, liver tonic, diet rich in nutrition and Rasayan therapy rejuvenation. Next is Prameha, urinary disorders including diabetes, a group of 20 urinary disorders including conditions similar to diabetes mellitus. Treatment is bitter herb like Gudamar, Gymnema, turmeric, Triphala and lifestyle management with proper diet and exercise. Next is Rajayakshama, tuberculosis like condition, a wasting disease due to an imbalance in all those features include chronic cough, weight loss and fever. The treatment is rejuvenation therapy, Rasayan, nourishing diet and herbs like Ashwagandha and Bala. Next disease and treatment is Swas, asthma and respiratory disorders. Breathing disorders are caused primarily by aggravated Vata and Kapha. And what is the treatment? use of expectorants like vasa, sitopaladi churna, steaming swadan and dietary restrictions. Arsha, hemorrhoid or piles, swelling in the anal region due to pressure or improper diet, often linked with digestive issue. And the treatment proposed by Charak is purgation therapy, herbal formulation like Triphala and Arshogani Vati, and surgical methods like Charasutra alkaline thread ligation. Next disease and treatment is Apasamara, epilepsy, neurological disorder involving seizures and convulsions due to an imbalance in those affecting the mind manas. The treatment procedure: medicated oil like Brahmi and Ashwagandha, nasal therapy, Nasya, and spiritual therapies including mantra chanting and meditation. So, it is again and again repeated in Charak Samhita the different aspect that the disease is not only the problem of the body as well as this disease affect the mind and soul. So, we have to focus on the dincharya, the riticharya, the discipline of life. We have to focus on the food items we take, we have to focus on the sleep time, we have to focus on the different food items what we intake. All things are disciplined for the healthy lifestyle, which we again discussion. Now, the gynecological treatment in Charak Samhita, whatever we studied that was just related to the overall treatment and disease. Now, this slide focus that what kind of gynecological treatment or disease we found that information in Charak Samhita. This table is related with the gynecological aspect. The aspect is menstrual disorder, very common in the present time as well. Irregularity in periods, pain and absence of menstrual cut, pain and absence of menstruation treated with those specific herbs like Ashoka, Lodra and Dashmola. Ashoka, Lodra and Dashmola are useful for this disorder. Next is infertility caused by dosha imbalance, poor nutrition or uterine issues, treated with tonic, rasayan, uterine cleansing and fertility enhancing herbs like Shatavari and Ashwagandha. These Shatavari and Ashwagandha is very important for this kind of disease or just inefficiency. Next is pregnancy care, month-wise diet and lifestyle regime, emphasize sattvic food, calm mind and herbal tonics like milk with medicated ghee. One thing I would like to express here, calm mind is always very beneficial for any work, not only for the pregnancy issues, it is not only for the females only, it is not only for the specific gender. This calm mind for the healthy lifestyle, this calm mind is always important for everything, for the every gender, whether it is child or old age people or male or female. Now, abortion and miscarriage, prevention through strengthening the uterus and mind using herbs like Lodra, Shatavari and lifestyle adjustment. Lifestyle adjustment, again and again Ayurveda focus on this term which is basically related to Dincharya and Ritucharya, the discipline of the day management, the style of the discipline of the day management. And nowadays all beings are just undisciplined with their day style, and this is the main reason for the increasement of this particular disease in this world. Next is postnatal care. Focus on digestive restoration, uterine construction and strength building using light diet, Dashmola rest and massage with medicated oil. Moving towards to the pediatrics treatment in Charak Samhita under the roof of Kaumarya Bhritya. This particular text Kaumarya Bhrit is mentioning the deep information regarding the infant child, the birth of child, the management of the birth child, the situation of the mother, all things is focused basically related to the child and the mother. Aspect, description and treatment. Neonatal care, emphasis on breastfeeding, especially colostrum, massage with the herbal oil and gentle bath with decoction. Common childhood illness, diseases like diarrhea, balatisara, indigestion, teething issue, cough and fever are treated with mild dose specific herbal formulation like Bala Chatur Bhadra Churna and Guduchi. Next is immunity and growth support. Use of Rasayan herbs like Bala, Ashwagandha and Suvarna Bhasma to promote immunity, intellect and strength. Mental and behavioral health. Advice on sanskar, purificatory rites, education, environment and herbal tonics to support mental development. Vet nurse selection. Detailed criteria for choosing a healthy, sattvic nurtured vet nurse if mother cannot breastfeed it. So, the vet nurse, the idea of the vet nurse or the concept of the vet nurse is not the 21st century idea or not it belongs to the 20th century. As we see in the Charak Samhita, in the section of Kaumarya Bhritya, there was a concept of vet nurse, and it is really very surprising that the ancient time the proper management of a child care was managed by the society and was studied by the ancient Vaidya or doctors. Now, the important medicinal herbs in Charak Samhita. There is, first one is Haritaki, the Sanskrit name is Haritaki as well, and the common name is Chebulic Myrobalan, and main use regarding this particular herb is useful for aids digestion, relieves constipation, rejuvenative respiratory support. Next is Amalaki, Sanskrit name is Amalaki and the common name is Indian gooseberry. This is useful for immunity booster, antioxidant, improve eyesight and support digestion. Third one is Guduchi, Sanskrit name is also Guduchi, common name is Giloy, and it is useful for detoxifies, treats fever, support liver and skin health and boosts immunity. Ashwagandha, the Sanskrit name is Ashwagandha, common name is Indian ginseng and useful for reduce stress, boost strength and fertility, anti-inflammatory, promotes restful sleep. Another information regarding the herbs, that is Shatavari, Sanskrit name is Shatavari, common name is wild asparagus and it is useful for enhance female reproductive health, lactation, soothes digestion, boost vitality. Next herb is Pippali. Sanskrit name is Pippali, common name is long pepper. It improves digestion, treats cough and asthma, boost bioavailability of other herbs. Neem, Sanskrit name is Nimba, common name is Neem, and it is useful for blood purifier, skin care, treats infection, support diabetes management. This is very useful. Brahmi, Sanskrit name is also Brahmi, and the common name is water hyssop, enhance memory and cognition, reduce anxiety and neuroprotective. So, here I mention few of the herbs which is mentioned in this Charak Samhita. Charak Samhita mentioned a long list of these herbs and how they prepare for the medicinal use. But in the contemporary era, few of them is already existed like neem and amlaki and brahmi and ashwagandha. It is easily available, but some kind of a particular specific herb is very rare and we have to protect that. These herbs not only give information regarding the treatment purpose, but it also give information regarding the ecological balance of that time nature. And these herbs are the basic significant features of the natural resources. We have to protect them, and by this protection we save ourselves, we just care ourselves on the basis of natural therapy. So, these natural resources, these trees, these Ayurvedic trees, these medicinal trees are very important. Now, importance of Charak in the Indian knowledge system. Charak is considered the father of Indian medicine as he played a foundational role in developing Ayurveda, India's ancient system of health and healing. He authored the Charak Samhita, one of the earliest and most comprehensive texts on internal medicine, which continues to guide Ayurvedic practice even today. Charak emphasized a holistic and preventive approach to health, focusing on maintaining balance between the body, mind and environment to prevent disease. He formalized the Tridosh theory, Vata, Pitta, Kapha, which became a cornerstone of Ayurvedic diagnostic and treatment strategies. Charak also outlined ethical guidelines for physicians, advocating for compassion, lifelong learning and responsibility towards patient welfare, principles still relevant in the modern medical ethics. So, on the basis of this, we can assume that the Charak Samhita is described the basic platform for the treatment purpose with the natural resources. If you want to enhance your knowledge in this particular topic, you can consult these information which is present on the slide right now, and these references is useful for your further study on this particular topic. Thank you for your patient listening. Namaskar.